Bismillahirrahmanirrahim. Doctors, let's we start our today's webinar, and I hope so you are all doing great. So first of all, welcome to all of you from AMC Prep Academy. I am Dr. Faiz Rasool, founder of AMC Prep Academy. So so many of them you know about us, but some of them are new here. But I have to introduce myself and about the platform. So as you know that today is a AMC guideline webinar conducted by the AMC Prep Academy. So before going to start, I would like to introduce about the platform. So everybody know about the platform where we are right now and what we are conducting. So so AMC Prep Academy is first platform in Pakistan that delivers the complete AMC-1 plan to all AMC aspirants around the globe. So uh, uh, we are delivering the quality-based education as per the latest Australian guideline, and AMC exam is a totally different exam as compared to other exam. So that's why we have to approach according to the latest Australian guideline, and every subject in Australia have a different point of view. So we have to go accordingly. So in today's webinar, we are two speakers. I am Dr. Rasool, and I will deliver the AMC exam pathway and resources. AMC-1, how to pass the AMC-1 exam and what are the resources. And along with me, Dr. Midat Haider will join us. And Dr. Midat Haider is XCPS consultant gynecologist and right now resident in Australia. So she will talk about the AM after AMC, what you will do. For example, you have done with AMC exam. So after that, what is the pathway after AMC-1? So she will talk on that. And right now, she is currently in Australia, and she's also delivering the lecture on AMC Prep Academy in their specialty. So I hope so. This session will be very beneficial for you and those who are just want to start the preparation. So this will be very beneficial for them. We will guide you step by step and what are the exact resources which you need to pass the exam in your first attempt. So inshallah, after session, your confidence will be different. Okay. So basically, what our main agenda of the day. So our main agenda, we will talk on the AMC-1 exam. Sorry. So just a second. So AMC-1 exam. Okay. So first agenda, AMC-1 exam and resource. And second agenda, what you will do after AMC exam. After AMC exam. So this is the agenda in front of you. We will talk about the AMC-1 exam scheduling and what are the scheduling over there and how you can book your exam in all over the globe. But for Pakistani students, before 2025, there was no center in Pakistan. But right now, you can book your exam in Pakistan and in Lahore. The center is functional. This is very good opportunity for student. Doctors, am I not audible, right? Am I audible to all of you? Doctors, am I audible now? Okay, okay. Audible to me clearly. Yeah. Doctors, please check your internet connection. So might be you have problem in your side. So that's why. And yes, yeah. So doctors, basically our agenda about the AMC-1 exam resource. What are the schedule? And the good news for Pakistani candidates is that you can book your exam in Pakistan. Before that, there was no center in Pakistan, but in 2025, only May, June, July, 3 month for 3 months the exam center is functional. But right now for 2026, it is available for whole year. After that, we will talk about the AMC examination, AMC pathway, and how you can become registration in Australia with Opera body, and what are the weighting and structure of the AMC exam, what are the AMC MCQ preparation resources, and what about the worth of the handbook. And furthermore, we will talk about the cancer screening because cancer screening is one of the most important part for exam. So you have to approach according to the latest Australian guideline cancer screening. So we will talk on that as well. What about the Q bank? And furthermore, recalls in AMC recalls is extremely important at the end of the day, which things which you have to pass is only and only is recall. So we will talk about the recall's importance as well. Moreover, we will have a bit discussion on the fourth and final year student because a lot of candidates asking from me who those who are in final year, they are very eager to prepare for AMC and how they can execute their time. We will have a talk on that as well. And what is the cost? So step by step, we will guide you in this way. And the second thing is that which will be delivered by the Dr. Mirat Haider. So how you can enter into the Australia after AMC Part 1 exam. So after AMC, one, how you can enter into the Australia. So this pathway will be delivered by the Dr. Midhat. So AMC pathway after registration. So AFRA is a regulatory body in Australia. So how you can affiliate it with them. So we will talk on that. What about the step of verification with AFRA? Job chances AMC-1, which is one of the most important and frequently asked question by candidates. And moreover, we have the what is the observation and what are the benefit of the observation. We will talk on that as well. Benefits of the observation. What about the CPD? So this is the discussion that we will have today. And right now, I would like to invite the Dr. Midat Haider because she's living in Australia. And right now in Australia, there is too late night, almost 2 to 3 a.m. because Australia is a 5 to 6 hours is time is away from us. So I would like to invite Dr. Mitat. Are you here? Just a second. I am here. Okay. So please unmute your mic, please. Okay. Okay. Just a second. Doctor, just a second. I have to invite Dr. Mitat Haider. Just a second. Dr. Mitat, no, please check. No, please unmute yourself.
Yes, am I audible to everyone?
Yes, yes. Assalamu alaikum.
Walaikum salam.
How are you, Dr. Mitat?
So I'm good, Alhamdulillah. How are you all?
Alhamdulillah, Alhamdulillah. So first of all, thank you very much, madam, for your time. Right now is very late night in Australia, but always
Yes,
you
it's
are here
too
for
late.
your students. So thanks a lot for that. And I know it is a
Mm,
bit difficult right now, but thank you.
No worries, it's okay. We can manage.
Thank you,
Okay,
madam.
so Assalamu alaikum everyone. I'm Dr. Medhat Haider. I have done my AMC exam the last year, and since then we have passed our exam. The Dr. Faiz, the founder of MC Prep Academy, has launched this platform to for all the students because for in our journey that was not very easy because we like were lost souls. We were like lost souls. Why? Because we don't have a good future information. Why guidelines are important? What are the importance of recalls? What's the importance of study partners? How exam things are going on, and these are the basic things. Even we at our time we didn't knew about once we pass the exam what will be our future. Even we don't have that much knowledge because the platform we used for our convenience or for our study materials, they haven't delivered that much information in this context that if you are going to pass the exam, what will be the next? Everyone saying just go through the AMC. You have to first give AMC-1, then you have to give AMC-2, and that's the thing. No, it's not the thing. You
Mhm.
have very much, you have a lot of options. Even just passing AMC-1, you can apply for a job. You can enter into Australian healthcare system. What will be the resources that we can enter into the Australian healthcare system? No one has told us. That's why once we entered this journey, we have gone through all these like hurdles. We have gone through all the exam things, and we gathered the information. And now we are here to at least support you, to guide you in a way that we were not. Okay. So today, I will be explaining about the pathway. So before I start, I want you to have understanding of APRA. So what the APRA is. Like is in our country, we have a licensing body that is PMDC. Okay. After passing our exams, this body gives us a license to work in Pakistan. But in Australia, there is the licensing body that we know that is known as the APRA. Okay. So this is APRA. What's its importance? How it's being affiliated with the Australian Medical Council, because it gives us the registration or right to work. Just give me a second because my pen is not working.
So,
So,
doctors,
Dr. Faiz Rasool, can
yeah,
the screen is shareable to me? Like I can work on it?
yeah, you want to share a screen, right?
No, I don't want to share the screen. I just want to write on the screen.
Okay, okay, okay. I will read.
Just allow me for that.
Okay, so you want annotation. Okay,
Yes.
just a second.
Sorry for the inconvenience, students.
So basically, no, please check.
No, I still can't do through the pen.
Please check. No, Dr. Midit.
Okay. Yes, my pen is working now.
Yeah.
Okay, thank you. So we will start with this. Our first, uh, I can't move the screen. Dr. Fest, can you go up just to start with the MC exam,
Okay.
the first slide?
Yeah.
Yes. So we will discuss first that how many pathways are there, like AMC pathways. Which pathway is suitable for which candidate? Okay. Like we have, again, my pen is not working. Can you highlight it for me?
Yeah,
My
yeah,
pen is
yeah,
again
Dr.
not
Midit. I
working.
can highlight for you. So you just speak.
Okay, so I will just deliver the lecture. So
Mhm.
we have three common pathways. The one and the most common route and most suitable route for everyone is the standard pathway. What is the like we parts of it is the number one, you have to sit in the MCQ exam, then you have to appear in the clinical exam, and the pesky one is like shortcut to uh, enter into a GP pathway. Everything will be explained regarding this standard pathway by Dr. Faiz Rasool. Then we have a competent authority pathway. This pathway who worked in UK, USA, or Canada. So it's a very good pathway for those. Like they can get quick registrations from APRA. It's not for us. Then we have specialist pathway for those who have done their fellowship, who have done their masters in our home country. They are eligible to apply for the specialist pathway. But there are certain um, a lot of documentation. a lot of scrutiny in this pathway. That's why it's a time taking and a bit expensive pathway. So most of the doctors don't opt for that specialist pathway because you need comparability here in the Australia. Whether you have did 4 year training, whether you have did 6 year training, still you need to from the relevant colleges. For example, if I'm a gynecologist in my country, but I have to submit and I have to give them proof of each and everything. There's a lot of waiting time, and even for application processing, even for the interview processing, I have to pay them. And then the relevant college like Renscock will assess my training, my qualifications, and on that behalf they will consider me as like I'm comparable to them, or I'm partially comparable to them, or I'm not comparable to them. Okay, so it's a very time taking process. The quickest way to enter into Australian healthcare system is the only standard pathway for us. Okay, so I hope you would be clear with this one. I will take your questions, but in the end. So just move the slide. Now we will discuss the registration thing. Okay, this is standard pathway. All the MCQ details, all these resources details, everything will be explained in detail by Dr. Faiz. I'm just focusing on once you have done the AMC-1, what opportunities are there for you to take? Okay, this is the only exam with part one. With just only passing part one, you can be eligible to get a job. This is the very like good point for AMC exam. Okay, for us to pass the AMC exam. Okay, but what are the different registration processes? We have to get, like, after passing AMC-1, you are applying for the job. And once you have an offer letter, like you have entered into a campaign, like different states, 5 states, 6 states of Australia offer campaigns. They have opening dates and they have closed. If you have passed your exam, you can apply through a campaign. You are in the pool, and once that pool closes, they will, if you are eligible or if you meet their requirements, they can just give you a job offer. Once you get a job offer, you are eligible to get a limited registration from APRA. Okay, so this one is the limited registration. Okay, so the second thing is the provisional registration. How you would be eligible for the provisional registration? Provisional registration is that you have did your AMC-1, and after passing AMC-1, you just start preparation for your clinicals, and then you have passed. But still, when you apply for a job, you get you get a job offer, and you apply for the registration, you get provisional one. Why? Because still you are left with those 42 weeks of work in the Australia. Okay, you have to work for 42 weeks in different departments, like surgery, like medicine, like emergency department. You have to fulfill that criteria. After 12 months of that internship or house job or RMO, as a working as a resident medical officer, whatever you will say it, but you have to complete those 42 weeks, and then you will be eligible to get the general registration from APRA. Once you have this general registration, the doors of every job will be open for you. Like, it's very difficult, it's but not impossible to get the first job. Yes, the efforts, the work, the study is very much needed. To make contacts is very much needed to get the first job. But once you completed your rotations in different departments, and once you have your general registration, you have a lot of opportunities. Either you want to become a registrar, either you want to become enter into the specialty of your choice, like you want residency here, you have a lot of options. But these are the actual steps that you have to understand after passing AMC-1, what can be opportunities for you. So this is the only exam with just passing AMC-1 you can get a job. It's difficult to get a job with AMC-1, but it's not impossible. A lot of students are getting job after just passing AMC-1. Okay, and depending which month you are passing and the campaigns are started for those months or not. So you have to be mindful about that as well. Okay. So steps of APRA registration. Okay, Dr. Riya, I will answer. Portfolio, we have to verify our degree from EPIC, and then we have to pass our AMC exams, and then we have to apply differently in hospitals in different states to get a job. We are eligible for limited registration. Like Dr. Fazana, I will answer each and every question in the end. Just let me complete
Doctors,
this.
don't
So
worry,
I
we will
want to
answer your
like
question. Just
don't be
please,
distracted.
we firstly we have to focus on the things, then we will answer your all queries. Yes, Dr. Midit, please.
Yes. So for the limited registration is like you have to pass AMC2 anyhow, clinical. After clinical, only then you can apply for the general registration. So, okay. So after passing AMC1, you have also cleared the English exam. That can be IELTS, that can be OET, that can be PTE. These are different English exams that we have to that are required. We have to show them that we are competent enough to speak fluently your language. Okay, so this is like that, and then criminal history check, and these are all the things that will happen later. But you should have the information about all of these things as well.
So,
So,
doctors,
what?
so the thing is
Yes, yes,
that
Doctor.
the PT, OET, IELTS is required to apply for job, not to required for booking exam. So this is the most frequently question from the candidate. So you just need
Okay.
to pass for job. Yeah.
Yes, exactly, exactly. Because I'm talking about the thing that once you have passed your AMC, then what the things or what the pathways you have to go through. So this is after just passing the AMC1. But for AMC1, there's no such requirement. You have just to create AMC portfolio, and you have to verify your degree from with EPIC. Okay. So, what job offers you can get after MC1 once you have applied for campaigns, the resident medical officer campaigns? So, you can get two different roles as a junior medical officer or as a resident medical officer. Okay. So, this is the thing when you get a job for after MC1. What is like
Doctors, what is intel this week of at the end of the session? This is not super important. The important things, firstly, we have to cover. We will talk on that at the end of the session, and we will tell you the expense step by step. So, firstly, the important thing is to discuss about the what are the scope of AMC1. So that's why those candidates who are thinking to pursue the AMC, they can satisfy with their decision and pursue their journey. So please, we will give your answer at the end of the session.
Okay. The other thing you must have heard about is the observership. So, what is observership? It's like a clinical attachment. It's not the paid one. It's not the contract base. It's not a job, but you get a chance. This is helpful for those who currently reside in Australia. Okay. So, if they until they get a proper job, they can apply for observership, and this is the quickest or the easiest way, I think, to enter into the Australian healthcare system. And once you entered and you just have to sit in that department, you have to just sit in that setting, and you have to observe what is going on. So you get an experience letter, and you get referees from them. So it's very important if someone is residing in Australia and they have just gave AMC1 exam and they just want to enter into the system quickly without waiting for a job offer, they can apply for the observership. Okay, it is conducted in the hospitals, clinics, and surgeries. So what could be the benefit? definitely exposure to clinical exposure to Australian healthcare system, to understand their system. It gives a very bonus point to highlighted points to your CV. Okay, it gives you it builds your professional network. It helps in the job application. When you apply in the future for the job, you have this observership experience that I have did my observership for 6 weeks, for 8 weeks in a renowned hospital. Okay, and you get referees. That is very crucial to in Australia. Like, even if you are applying for a job and you are not here, you have not worked in Australia, but you have worked in your country, they will ask you for the referee. Okay, they will ask you to give at least three references, their contacts, their details, their designations, because they will contact your referees, your consultants, your supervisors in your country. Okay, so referees are very important. And in if you are getting observership here, you will get the referees from Australia. That is a big, again, a big bonus point. Okay, this was all about the observership as a clinical unpaid attachment. That's it. Now, those who are not working, or those who don't have enough experience, like they are fresh medical graduates, they have just did their internship or house job in our home country. So those can be applying for those can be very good candidate for the CPD. What is CPD? It is a continuing professional development. It's not for just for us, but even the doctors who are working here, they also have to collect new CPDs, because it shows that you are in continuity. You are developing professionally. Okay, so this is mandatory for doctors in Australia. Either they came outside from outside, or they are in working here. So yes, once you get CPD for certain hours, or once you get CPD, that would be eligible for 1 year. So how get CPD? Like, these are the paid options. Okay, but there are, like, CP is the website from where you get CPD points. These are mandatory. These are for APRA, because APRA wants you to be continuity, wants your to be developing continuous. Okay, if you have no experience, if you have no experience, okay. Am I audible now? Am I
Yeah, yeah.
clearly audible to everyone?
Yes, no audible.
Okay, so these CPT points are very crucial. Okay, those who are very fresh graduates, and those who have a big gap in their clinical experience, like they did their house job, and after that they haven't did anything, they haven't done anything. So for them, this CPD is very crucial. Okay, and it gives it again gives a good weightage to your CV. So it's one thing, it keeps your knowledge up to date, and it improves patient care with respect to Australian healthcare system. It maintains the registrant track's professional growth, because once you are continuously listening the lectures, once you are continuously attending the webinars for those topics, then you are developing your knowledge. Okay, and it ensures the staff medical practices, because they emphasize on the practices. These are all the clinical topics, how they are things, how the managements are going to work here for the respective diseases, for the respective system. That's why it's very important that APRA needs your CPD points. Okay, but if you are continuously working in your country, okay, so CPD would be less crucial. But those who are not working or who are fresh graduates, they must update themselves with the CPD thing. Okay, now you can ask your questions. I'm done with the presentation thing, or should I? Okay, I'm done with my presentation thing. Now, if you have any questions, you can ask. Okay, it depends, Dr. Aisha, but minimum of 6 weeks. The observership is minimum for the 6 weeks. Okay, even those who are living here in Australia, They did not get, for example, they did not get any job. They are not able to get observership. They even can work here as volunteer. Like these hospitals, these people appreciate those who work as a volunteer. In volunteer thing, again, like you have nothing to do. You have to just observe. You have to just help them. You have to just tell the patient that this is the ER department. You can go here, just to help them in a way that the patient don't get lost in the hospital. Okay, so these activities are very much important. Once you entered in the hospital as a volunteer, you can enter into the HR department. Then you can make the contacts. So the basic thing is you have to enter anyhow. Once you get enter, then the doors open for you. Okay. Okay. So Dr. Yasir has asked about which pathway will be best one for someone with MRCP and MBBS. So you have did your MRCP, all three parts or just part one? If all three parts are clear, you can contact. All three parts are clear. Okay, this is best. You can then apply with the GP pathway. You can uh, go through GP pathway. You like can easily applicable for the GP pathway. You have to contact the brokers, and after that you can get entry as depending on your experience they will give you a supervision level, that supervision level 1, 2, or 3 depending on your experience. Observership is not a part of CPD, but is a good thing that once you did your observership, you can continue, like if your work is like good to them, you make contacts, you make your referees, you can even continue job in that hospital if there is any vacancy. Okay. CPD in Pakistan, I told you, Dr. Ria, the website think gp is the website where you can get CPD hours by listening the lectures, and this is like free.
Yes, we have also another website like OSMED and GP thing.
Yes.
Another you can get online. It is not a big problem, but just
Yeah,
right
it's
now,
not a big problem. You can get these websites easily.
yeah.
Okay, the one with Oppo. Your question will be addressed by Dr. Faiz in detail about AMC-1 exam, the study, the books to be followed, and the references and the resources. Okay. Uh, yes, Dr. Mahavish, you can get job in that, but still, if you add CPD, it will increase the weightage of your CV. Okay, if you have someone with GMC registration but not NHS experience, then you can apply for the limited, not the general registration or the provisional one. You have to do NHS experience for directly get general registration. Okay, WBA. Yes, very good, Dr. Aisha Jafar. I just forgot to give some light on the WBA. WBA is actually a work-based assessment. Okay, after passing AMC-1, we have two main things. Either we go for the clinical, the preparation of AMC-2 exam, and we have to give the AMC-2 exam, and we will be eligible for the provisional registration after getting the job offer because we have AMC-1 and AMC-2 now. The work-based assessment is that you get a paid 1 year job in a hospital, and every 3 monthly or it's a week, like weeks, every 21 weeks, you get assessed by the professors, by the supervisors, by the department. And then, if you are going to the WBA pathway, your clinical will be automatically skipped. Once you are done with WBA, now with NC1 and WBA, you are eligible to get a general registration for APRA. Is that clear? Yes. Dr. Sonu, complete MC1 job offer, and with that job offer, you are applicable for the limited registration. CPD is for those, yes, who have clinical gap. But if you don't have any clinical gap and you have time and you are getting CPD, it's a good thing again. No, uh, see, it's not like we can't say it's easy to get or it's difficult to get. You don't know in which state you are applying. It depends where are you currently right now. What is your experience? What is the vetting line in that hospital? So it depends on multiple factors. You
Doctors,
still have to give MC Part 2 after the job offer. Yes, you definitely have to give. You for the general registration, you have to give MC Part 2.
AMC Part 2 actually is for residency exam. So whenever you pass, you can go to the residency. So you have to pass this if you want to a general registration out there.
Yes, because with the limited registration, you have limited offers. Best time to get CPD, can I do in my house job? Yes, you can do, Dr. Nimra, but make sure it will be just valid for 1 year. Yes, CPD will definitely cover that gap, but if there's a clinical experience, that will have more weightage. No, WBA is paid. WBA is paid. It is different from RMO or JMO in the sense that in if RMO is like you are doing a job, okay? No one is taking your exam. WBA is the work-based assessment. You do work there and you get assessed every 3 monthly there. Okay. So you have to pass again those short cases, those long cases. So it's all the time, whole of the year, you are under surveillance. You have to give exams, you have to pass. But it's a work based. You get job, you get paid, but you have to be past those steps. Yes, then if you have just passed part one and two, then you have to choose the standard pathway because you get this you will enter in the GP pathway after passing part three. Which type of research you are talking about?
No, doctor, in AMC research is not super important, but if you have done with the research, it is a good thing, but not a mandate part
You
as
can
compared to
add
other.
in the CV. Yes, you can later add in the CV, but it's not like important for MC1. Okay, I was talking about referees in a way that when you apply for a job and you like give them your CV and cover letters, they will ask you for the referees. So you have to mention them, like the supervisor under you have worked. You can add in this Dr. K. Chaudhary in your CV. You can also add that experience as well. But clinical experience is required. Yes, you can prepare along with the house job. No, AMC is not like until you pass your MC2, MC1 is valid throughout your life. It's not like it's getting expired. How to find referee? You don't need to find referee. Wherever you worked, you have to give their reference. That's it. Your consultants are your referee. Your supervisors are your referees. Your head of departments are your referees.
So, doctor, mostly candidates are asking about CPD. So, this is the resource you can search on a website as well, and you can download the application. So, PrexHub
I have,
or Postmed,
I have
Medcast,
shared.
Things GP. So, this you
Just
can.
write, you can write this on the wall, Dr. Faiz, the website name. Just give them those website names.
Okay, okay.
Observership, I'm Dr. Madhya, I'm talking about the observership in Australia, not in our countries. That would not be that much helpful. Uh, okay, eligible for SH or RM job, what kind of clinical experience they need? Uh, at least you have done with your house job. And it would be a recent one. It's not like you have done your house job 5 years ago and now you're applying for this RMO campaign. Then it would not be that much helpful. CPD is valid for 1 year. Okay, Dr. Mohammed Hassan, an MC1 with 5 years of experience can apply for job. Yes, you can apply for job. This experience counts a lot. Okay, you have completed your training, that will count as the work experience. But if you have done with your exam, then you will it will count as like it will have more weightage if you are done with your exam. But just training, that would be work experience, and you have a good work experience. You can apply, and you like have a good chances to get a job. Yes, it's getting saturated now, but still they need doctors. Still they need doctors.
Dr.
Because it's
Farzana, what is your
not
question?
only the saturation for the doctors, but population is also getting increased, so they still need doctors. So, which question? Which question? Sorry, Dr. Fazana, I didn't get your question. Tell me, I have completed MD anesthesia. Okay, if I complete MC1, then can I get any advantage? What sort of advantage? If you have completed your MD in anesthesiology, you have a good experience. You can add that experience. You can apply in if the relevant jobs are there. That will be beneficial for you anyhow. Yes. eh, who have after Ireland or GMC registration, they can go through this competitive authority pathway, and that is the advantage for you if you have applied through that. You have that GMC registration. You are the lucky one. You can enter here quickly, more quickly than NC1 if you have GMC registration. Then no, Dr. Kainat, the website that me and Dr. Faiz has told you, they are free. Not that much, but to apply for like if you are just applying on the basis of AMC1, in that case you need these observations, you need CPD like things, you need courses even. If you are not done with your courses like ALS, the airway management courses, if you are doing these basic life support courses, they also give a good weightage to your CV. So I also recommend every one of you to go through the ALS. But after passing AMC1, just you have to now focus on your AMC1 exam.
Doctors, OET is not mandatory for exam, but once you have done with AMC exam and now you want to apply for job, then you need any language test, and the easiest is PTE. So PTE is
Yes.
one of the most easiest and cheap exam as compared to OET.
Okay, so Dr. Nimra, yes, you are right. With AMC2 or WBA, both are the ways to get genuine
Doctors, CPD is a not too big
registration. Yes.
game. The people are again and again asking about the CPD. CPD is a not a big game. You can like get a CPD online without any problem. So just you have to focus on AMC part one. So once you're done, and the CPD will be easily available.
Okay, Dr. Chaudhary, which visa type we have to apply for what? For giving exam? MC1 is you can do in Pakistan. Okay, yes, you can skip MC part one, but you have to do that 42 weeks of job or rotations in different departments. Then you can only get to MC2 and general registration. No, it's not easy to get just visa for observership. No. Once you have a job offer, you can apply for a work visa then because you have a sponsor somewhere, someone here. No, it's I said mandatory for those who have a very huge clinical gap or those who have very less experience. So on just with the one exam, if you want to apply for a job, at least your CV have should have some weightage. Okay, your CV should be that much attractive that they can like there would be you would be eligible to get the job, to get selected. That's why. Okay, website where we can find online books. Our platform will like give you access to all these material. What do you want to ask me again? Yes, I told you that MC1 and MC2 or WBA both give you general registration. I told Dr. Nimra, AMC2 or WBA, both are the ways to get general registration. If you entered in WBA, then you are not eligible to give AMC2. You have to continue your WBA. Okay. Any other question? Yes, 1 year. Depending on which hospital you are applying, Dr. Sonu, for WBA. If is there a long wait line, then you have to wait for 1 to 2 years. Dr. Raj, what you can do to improve your CV, you will get clinical experience. Okay, continue your jobs, continue your clinical experience. If you have time, add your CPD points. And most important, do basic life support courses, do ALS, BLS, airway management, do short courses like that. Uh, Passing ratio is low, yes, because it's a difficult exam. They are giving you the general registration. You are eligible for the general registration, so it's a difficult exam, but it's not impossible one to pass. Yes, either you need MC2 or WBA. I was talking about advanced life support system programs or basic life support system programs. Our hospitals uh, usually provide these sort of programs. Dr. Vani, again, AMC1 would be the best route, like the standard pathway. Yes, the account process details, I think that will be explained by Dr. Faiz in his lecture. So just
I
continue with
think
the
the maximum question
webinar.
you have covered. So we have a major things left behind. So I think we have to go with that right now. Is it okay? Should we move to next
For
part?
sure, for sure. I think that most of the things will be cleared in the next part as well. So most of your queries will be solved there. Just MRC1. No, Dr. Raj, just MRCP1 will not add any more chances. Experience, clinical experience matters. It's a good thing if you have that, you can add in your CV, but not that much important.
Okay, so I think we have to move to next topic, right? So thank you very much, Dr. Midit, for your time, for your
Welcome, and
guidance to your students. Thank you, Jazakallah. Means a lot. So we should have to move to next one.
thank you everyone. Thank you, Dr. Faiz Rasool, and thank you everyone for
Thank you.
having me. Thank you so much. Allah
Thank you. Thank you, Jazakallah. Okay, doctor. So move to next part. The one of the most challenging part for each and every candidate. What are the resource? What are the things you just have to focus, and what are the resource to prepare? So we will go with each and everything. And what are the format of AMC exam? As Dr. Miller told you about the AMC examination, we have, if we talk about the standard pathway, we have AMC MCQ, AMC clinical, and PESCI. So our today's further discussion on AMC MCQ exam, and this we also called as AMC1. Okay, so we will go through with that. So before going to start, there is a 2026 examination dates. A lot of candidates are asking. So this exam will be take place for February to till November. Every year you can get your slots within this 10 months. Okay, December and January there is a no any exam. So in 2 months, 10 year February to till November, you can book your exam, and this exam will be start from Monday to till Saturday. Okay, it means you can book your exam at any day in the week. So right now, the April exam week will be start from the Monday, and it will be continued till Saturday. So like this, you can get your seat. Okay, so this is the examination schedule, and no, this examination you can book your in the Pakistan Lahore. Okay, for Pakistani candidates. First, this is the dates are all international students. Yeah, doctor, it is get seats. Yeah, doctor, you can find the seats in Pakistan as well because this exam in the whole week, so you can get it. But it is better to apply for before you can book. Firstly, before going to book your exam, you have to complete your uh, degree verification process from Mind Health and other stuff. So firstly, you have to done this. Okay. So, okay, so dreaming of becoming a doctor in Australia, but not sure where to start AMC journey and what are the resources and how to start, right? And this is the challenging task for every candidate. And this lady searched a lot from the internet, but at the end, she is too confused and don't want to continue. And this guy is thinking about to change the journey from AMC to another exam. And this is the real experience I can receive from the candidates. And doctors are asking to me, should I change my AMC journey to another journey? And might be I am not born for this exam. And this is a very huge domain and a scattered resource. We don't know the things. But don't worry, we are here to support you, guide you till your success, and we will guide you each and every resource and how you can start your preparation. We will tell, and after that, the face will be happy. Yeah. Okay. Okay, doctor. So the important part. No. So what is the AMC exam form? AMC exam total question is 150 question. Okay. And duration for 3.5 hours is equal to 210 minutes. And this is a computer adaptive test, computer based test. What is the pass score? You have to take 250 marks out of 500. It means 50% you have to take. Okay. So this is the bar graph will be shown once you check your result and show like this. And I hope so everybody would like to see their score margin at right side. Yeah. So about 250 is a score to pass. And a lot of candidates, believe me, a lot of candidates passed at 250. So in AMC exam, each and every single score have a lot of worth. So 250 is passing, and at 249, a lot of candidates fail. Okay. And in AMC exam, the good score still candidates can get till 300, or you can say 320, not above from that. Because this is a difficult mood is increased here, you can get a low scoring question, high scoring question, as well as pilot question. So in 150 question, so for example, you have 150 question, 30 question is pilot question. Pilot question. So what is the pilot question? So 20 to 30 question is pilot question. Pilot question means it contain no score. So 20 30 pilot question, and the remaining 120 question is scoring question. Okay. So this is scoring question, and pilot question means zero score. And what is the mean of scoring question? In scoring question, you will get might be the from one score to till you can get 6 to 7 score for each question. 2, 3, 4, 5, depend upon the importance of the topic and difficult of the question difficulty mode. Okay. So accordingly, you can get your score. If the topic is important and it is tough topic, definitely it contain a massive score. Might be 7 or 8 till maximum like that. Okay. So this is the thing. And another thing. So always. So this is one of the major mistake which AMC candidate uh, can done, but you must know. Always a last 30 question, like 120 to 150 question, always high scoring question. Because AMC know that at the end of the exam, candidates have less time, so for they increase the difficulty mode. So that's why always 120 to 150 till 30 question is a high scoring question. So you have to manage your time. Okay, for last 30 questions. So this will be a life saving for you to pass. Either it will decide to pass or not. One candidate, I received feedback from one candidate, and she's from Bangladesh. She attempted only 133 questions and she got 233 scores. And when she contact me and want guidance, so when she give me a history and said I only attempt 133 question and I get 233 question. So you can, I am just thinking about that. If she attempt the 150 question or maybe 140 question, she will be passed. But unfortunately, she don't know the guidance. She don't know the exact idea how we can manage the time and how we can execute their time at the last 30 question. So this is the thing at the end of the day which help you to pass the exam. Not only the hardworking, yeah, hardworking necessary, but the tips and tricks how you can manage your time. You can get 84 seconds for each MCQ. And 84 seconds is enough time. You can think about say diagnose, management, and investigation as well. So this is the important things for you. Okay, move to next. We have weighting and structure of AMC exam. So what are the subject here? So in AMC exam, you don't need to go for the basic subject. Here is totally the medicine. Okay. So medicine, there is a clinical subject you have to approach like this. So what are the weightage of the medicine in exam? This is the 30%. And in surgery, 20%. It means total 50% from the medicine and surgery. What about in case of obstetric and gynae? 12.5% you will get portion from that as well. And the child health will be 12.5%. Okay. So it means 25% from this. And what about the mental health, which is one of the most important part of exam? So it means from psychiatry, you will get a 12.5, but it doesn't mean that you will get only 12.5%. Might be you will get at 15% question from there, 20%. It will be depend upon computer to computer because it is a software based exam. They create a messy pool and from pool you will get question. So that's why this is one of the most important part. And mostly doctors skip this because they haven't done with psychiatry in the MBBS or their medical journey, but it is worth it and it is extremely important for exam. You have to go through with that. And what about the population health? 12.5% as well. Okay. So this will make a total 150 question. Okay. And out of 150 question, we discuss 20, 30 question is a pilot question and 120 is a scoring question and last 30 question is always high scoring question. Okay, move to next. Next, we have AMC-1 resource. How you can start your preparation. This is the one of the biggest concern by AMC-1 candidates and for beginner students. So in AMC exam, you will find out there is a no any structured syllabus. There is a scattered resource, and it is a difficult for candidates to think about and to get a structured syllabus because every subject have their own guideline. Medicine, surgery, gynae, pediatry, major, minor, each and every subject have their own Australian guideline. And second thing is that in Australian guidelines, for example, if we talk about the medicine have a lot of guidelines, but candidates don't know which guideline is authentic and which we have to follow. So this is the concerning part of the AMC journey. So that's why the people will get tired to search the guideline from the internet resource and difficult for them. But here we will talk only about the authentic, reference-based and up-to-date guideline. So for medicine, as you know, there is a 30% medicine portion. So it means extremely important and will a lot of contribution to help you to decide either you will pass or you will fail. And this is one of the medicine. So medicine, we have a John Murtagh book, okay, JM. So this is actually we use this book for theory purpose. Okay. And John Murtagh book, no, a lot of people have concern about the John Murtagh. This is very lengthy book, almost 4,000 pages book. So it is, how it is possible that you can cover the John Murtagh and again go through with that? It is impossible, right? So John Murtagh, basically we use this book for AMC preparation. Either it is part one or part two, but it is not like enough for your exam. This will give you only 30 to 40% exam coverage. Okay. So 30 to 40% will be not enough of to pass your exam. And you have to go along with the other things as well. Okay, so John Murtagh medicine, you have to approach like topic wise. This book is not written like a systemic. This book write on topic based. Okay, so topic based you will find. For example, you will get chapter on chest pain. You will get on a chapter on the diarrhea, constipation. Like there is a symptom chapter. Each and every chapter is on symptom. Pericarditis, you can find the chapter as well. A lot of this symptom you can get a chapter on that. And so this is the most important and most concerning by our candidates. But you have to approach each and everything in a well structured manner way and only approach to the like selective topic. AMC doesn't need you have to go through the complete system. No, AMC need you have to approach like stepwise with only to the point and frequently asked topic by in previous recalls. So it means topic based study you need. Topic based, not to go through the complete system. Okay. So this is the thing. Okay. So once you have done with the John Murtagh theory, what are the guidelines which you have to go through for their investigation, management, up-to-date treatment? So this is the RSCGP. The RSCGP is one of the major guidelines in Australia as well in case of medicine, right? Also, you can use the ETG. ETG is like one of the superior guideline in management cases. Okay. So superior guideline in Australia, and this guideline almost cost is $400. It is not accessible to every person, but it is paid guideline. So uh, from every case, like in case of management, in case of antibiotic, or especially this guideline is made for management, how you can manage the condition of each and everything. You can use the RSCGP as well, and you can use the ETG as well. Okay. So, but few of the thing is important which we have to go through with ETG. But rest of the things you can find out on RSCG as well. It is not a mandatory that you have to buy the ETG. Not a mandatory. A lot of candidates don't have. So it is not a mandatory, but few important topics you have to go through with ETG because ETG have one of the latest treatment within the year they update their guideline as well. So do you have to go through with that. So for 30% you have to go with the John Murtagh. The guideline will be RACGP, and also you can go with the ETG. If you have ETG, it is a good thing to do. Okay, so this is about medicine. What about the surgery? So is there any topic list for theory purpose? Yes, doctor. This is most frequently topic like which asked in the recalls question. So a lot of topics, long list. So you have to approach accordingly. So that's why in AMC, if you are struggling to prepare in AMC, it is difficult for beginner students to prepare for AMC examination because there is a lot of scatter score. So just for we have discussed with the medicine part, know what is this surgery. So surgery, the one of the book is we can use the Kaplan step to CK, and Kaplan step to CK. One of the most important part is trauma part. Okay, so trauma chapter is important for Kaplan. Okay. And for orthopedic, you can use the John Murtagh as well. And what is the website? The website is Orthobullet. So you can use, in case of orthopedic, you can use Orthobullets is a website. And for theory purpose, you can go with the John Murtagh. And in case of trauma chapter, because trauma is one of the most important part of the exam, emergency. So RTA cases, you have to go with the Kaplan chapter, trauma chapter. This is important. And orthopedic, you can go with the John Murtagh selective topic. As I told you, no need to go through the whole system, just selective topic. And after that, take help from the ortho. Okay, what about the pediatric? So this is the 20% surgery part, and pediatric is 12.5%. So for pediatric, we use the book John Murtagh, okay, and selective topic, selective. And for guideline, one of the most important guideline for pediatric is RCH. Extremely important. I can't emphasize on that. How it is important, and you will get direct question from that as well. RCH. Just you have to write the topic and RCH and a guideline in front of you, and a lot of question from this as well. Okay. What about the gynecology and obstetric? This is also contribute in exam 12.5%, right? So in that case, gynecology and obstetric, the book we used is the John Murtagh as a theory, or you can also use the Kaplan step to CK. Anyone you can choose. Okay. If you have done before with a Kaplan, so you can go with Kaplan. If you done have before John Murtagh, you can use the John Murtagh. Theory books you can anyone use. But the thing is that what is the guideline for obstetric? And the guideline is one of the most important is SAL. So SAL is a basically guideline we have used in for pediatric, and their flow chart is extremely important. Flow chart, so flow chart extremely important. So they will all summary in one flow chart. You will find a lot of lengthy article, but flow chart will give you all information. And okay, so what about the gynecology? For gynae, we use basically the Rensgo. Rensgo guideline we use for gynecology, as well as we can use the Queensland Health as well. If you if there some topic are not present in each and every guideline, but for that you can set the alternative guideline like Queensland. But SALC is one of the most important for the obstetric one, and gynecology you can go with the Rensgo or you can go with the Queensland. Okay, what about the psychiatry? Doctors, okay, sir, how to know what to study as John Murtagh is very lengthy book. Yeah, doctor, okay, I will uh, give you your question answers after that. Yeah. So what about the psychiatry? Psychiatry is 12.5%, as you can see, but it could be like 15% or might be 20%, because this is one of the most important, and psychiatry cases in Australia is a lot due to the drug abuse or like this. So for that, you can go with the Kaplan Psychiatry. Kaplan Psychiatry is one of the best resource. I can't emphasize how they write in very easy wording. So it is a best resource. Okay. So Kaplan surgery is the best resource to prepare for psychiatry as a theory. And also you can go with the therapeutic guideline, because in some of the topics is extremely important and you can find in the therapeutic guideline. Just write the topic. If you have a subscription of therapeutic guideline, the topic will be in front of you. And this is important. A lot of questions come from that as well. And after that, you have to go through the QBank like U word psychiatry. Unfortunately, Australian don't have any specific guideline for psychiatry, but the Q bank, which will give you a lot of knowledge, you have to go through with the U word psychiatry. Okay, as a Q bank. Okay, doctors. So U word psychiatry is important. After reading theory from the Kaplan and taking help from the therapeutic guideline, you can go with the U word psychiatry. So this is the way that you have to approach. Okay, move to next. Next we have the sexual transmitted diseases. This will like a lot of question from this, and STI is common in Australia as well. So for that, you can go through with the STI Australia guideline. Okay. So ST Australia basically is a very simple, and you just have to write the ST Australia. They will give you the list of all STIs. Okay. So list in front of you, and you can go through with that. But you have to approach selectively, like gonorrhea, syphilis, chlamydia, and rest of the other things which is important for STI. So you have to go through straightforward with STI Australia guideline. So this is the very important guideline and very, like you can say, summarized form. There is a not like a lengthy article, only to the point which you need for example. Okay, so next we have ethics. So ethics is important as well for exam. Many questions come from ethics as well. Ethics also don't have any specific guideline in Australia, but you can go with the 100 cases of convert feature. This is the USMLE resource, but you can go with that. Actually, this question will come give you the idea how the actual ethical question come in exam. So you have to just take idea from the 100 cases of coordinate feature, and then you can practice ethics from the QBank as well, eMedici and Emedics. So Emedics and eMedici will have a lot of question on ethics, so they will give you the actual idea how the question come in exam. And this is important. A lot of ethical question you will find out. Okay, move to next. Next, we have ophthalmology and ENT. Ophthalmology and ENT, the main book is John Murtaugh. Okay? And along with that, you can go with the RACGP guideline. And after that, you can practice the question from emetics as well. Emetics have a lot of question like a straightforward, like have picture form question for especially ENT. And also you can go with the e-medicine. E-medicines are nowadays is recommended. Before April 2025, there was emetics recommended by AMC, but after that, the e-medicine is a Q bank which is recommended. But emetics have a few questions, like few topics you can go through as well, no problem. Okay, next we have infectious disease. So infectious disease is also important part of the exam. So infectious disease you can go with the med yourself. Okay, and if you have a subscription of therapeutic guideline, you can go with that as well. Okay. So med bullets is like important guideline, and it is a very well summarized form guideline. You will find out the like clinical feature of the topic as well. What about the risk factor? What about the causes as well? After that, you will find out the what is the investigation, what is the management. So 4 to 5 things is important in exam, and this guideline only right in this way. So what are the clinical feature which will help you make the diagnose? After that, what are the risk factor? This is also important for AMC exam. And what are the investigation, and what is the management? And AMC exam, you have to approach any step according to the Australian guideline. For example, they will ask you the what is the first line of investigation? Okay. If first line is fail, what is the next best step? If next is a fail, what is the most definitive test? Most definitive, or you can say the gold standard test, or you can say the best test. Anything. This is the same terminology you will find out in the Q bank as well as in recalls. So the way you have to approach in case of management or in case of investigation, the things are same. For example, you have started the treatment with a antibiotic, and they will ask, what about the first line antibiotic? If first line is not working, what is the next step? So what is the second line? If not fail, what is the next step? So like this way you have to approach. And what in case of, for example, in case of any comorbid condition or any contraindication. So what is the drug of choice in that case? They will ask question on this topic. So they will test you like this. Okay, doctors. Doctors, are you with me? Doctors, are you with me? Yeah, yeah. Doctor, are you understanding me, right? So this is the things which you must know for exam. Okay, okay. Yeah. Yes, sir. Thank you. Okay, so this is the way you have to approach in for AMC examination. They will ask all the things in a stepwise. First line, what is the second line, what is the most definitive test, and same in the amendment. So this will make the like increase the difficult mode of exam. Yeah. Every topic you have to approach, either it is a medicine, surgery, gynae, pediatric, major, minor, you have to approach stepwise. What is the first line investigation? What is the best investigation? So this is way you have to approach. What about the dermatology? Yeah, dermatology question in the form of rashes, or they will give you a picture basically. So you have to diagnose the condition. The book which you can use for theory is John Murtagh, and after that, you can go with the guideline terminates, or you can choose the RCGP as well. Okay. For example, any basal cell carcinoma, just write basal cell carcinoma RCGP, they will give you, and approach accordingly, which the things written on the RCGP as well. Okay. And you can also search the terminates. If you didn't find a single topic from one guideline, you can find the alternative as well. Okay, driving. So question come from the driving as well. 1 to 2 questions you will get in each paper. Yeah, in your own question, in your own paper. So 1 to 2 questions. So 1 to 2 question means might be this question will contain 4 to 5 score single question. So that's why you must know. So the guideline is Australia, OS Road Australia. So this is the basically guideline of website. Okay. So website OS Road, what are the protocol written here in the OS Road? You have to follow that, then good to go with the exam. But about the imaging. So imaging is one of the most important, and you will find out the imaging question on you will get a CT scan as well. You will get X-rays. So X-rays and CT, this is one of the most important part. MRI or ultrasound is a not here, not important here. So no need. So just you have to focus on the CT and MRI. So driving portion question come they will for example patient have hypoglycemia. So what is the recommendation to that patient how when he can drive, and you have to approach according to the OS road. And for example patient have epilepsy, so epilepsy patient, how you can counsel the epilepsy patient and when he can resume their driving as well. For example, patient have stroke, when he can return to the driving, and a lot of other conditions. So this way, this approach you have to know. Yeah. So that's why, for example, in case of VN, you have to they set a protocol for the VN. If VN is good, then you can recommend the driving. Otherwise, you have to report to the bodies over which is responsible over there. Okay. What about the imaging? So imaging, you can go with the radiopedia. Okay. And CT scan is important here, extremely important. And you will get 2, 3 questions from CT as well. And also the X-ray. Both are important. Doctors, each and every discussion word is important. So that's why I am emphasizing on that. So CT, X-ray will be important. And CT, a lot of CT come from this liver CT as well, brain CT sometime, and X-ray of the abdomen, pelvic. So also the fracture X-rays. This is the important thing. So you must know, and you will get a lot of questions from each and every single paper as well. Okay, so this is the all about the major resource which you need to know about that. Now we are move to the next about the handbook. As I can see, a lot of groups people are discussing about the handbook. Okay, start from the handbook, start from the recall, start from. But actually, this thing will not work. You have to approach stepwise. as the things we discussed. Firstly, you have to cover the theory first. So first of all, those who students who just want to start the preparation, what's the thing they should need to do? So firstly, you have to start from the theory. Okay, theory. After that, start go with the Q-bank. Okay. Also, you can start here after Q-bank. You can start here the handbook as well. Okay, and you can go with the recalls. So this is the way like you have to approach theory, Q-bank. You can start the handbook. You can go with the recalls as well. So this is the thing you just need to know. Should we need to make our notes for theory? Yes, doctor. Yeah, you can. This is a good thing. If you can, you can. Okay, so handbook. So handbook basically this is a very outdated book, almost 2000 ninth edition. Yeah. After that there is a no edition come, latest edition come. So this is the outdated book, but still worth it. Still worth it. Why? Because you will get a lot of question from 1 to 2 question from this book and the same imaging question, same image. So imaging question is extremely important. You will get straightforward. They will copy paste. You can say yes. So the imaging question is extremely important as well. And at least you have to you have done with this book at least twice time. Okay. So twice time you must go through with that book. And when you are near to exam, and we already shared this imaging PDF with our candidates. So once you have done twice a time with handbook and know you are near to exam, like next month you have exam, you have to go through with the imaging question. Okay. So imaging question is important. Like you will directly get the imaging question in your exam. Or okay, doctor, I can see your chat as well. So should we make our notes? Okay, what are the Q-bank? Yes, sir. I am moving toward Q-bank, so we will discuss over there. Are these books available on the website or platform? Yeah, yes, doctor. I will get. Yes, this book is available. Don't worry. Okay, so this is the importance of handbook. And for example, the question on the treatment. So for treatment question, you have to go with the latest guideline. Okay, like antibiotic question. Okay, antibiotic question as well as cancer screening question. So cancer screening question is important. So these questions you have to just give a statement, read here, and their management, their cancer screening go with the red book 10th edition. And for antibiotic choice of antibiotic for treatment, some question is outdated in the handbook. So for treatment protocol, you have to go with their relevant guidelines. But you have to do at least twice time. This is extremely important. I can't emphasize on that how much it is important for you. And imaging question must you have to go through at least 2 to 3 times. Okay, doctor, I will answer your all question. Just firstly, I want to cover the resource, and then after resource, I will answer your question as well. Okay, next we have cancer screening. So cancer screening, for cancer screening, you have to go for the Red Book 10th edition. This is the recommended book so far, and this is updated in the September 2024, but still it is recommended. So you have to go this logo Apple. Okay, so Red Book 10th edition and all cancer screening you have to go through with that, like colon cancer, breast cancer, prostate cancer. Okay, also you can go with the lung cancer and other stuff. So this is the recommended guideline. And what are the things you just need to know in this case, like cancer screening? You know about the protocol of the screening when you start this screening according to the Australian guideline. What are the risk factor, mild, moderate, and severe risk factor, moderate, and in like high risk category. So what is the recommendation of the screening when you will start? For example, in case of colon screening, right now Australian guideline for that you can start the FOBT at 45 years. Okay, for category 1. So start from the 45 year of age. So this is the age factor when you will start, you must know. Okay, and what is the like mild category 1 in case of colon cancer? This patient can will diagnose after the age of 60 years. A lot of time we have done with this question in recalls. So those people who have attended our recalls classes, they know about these things. Okay, so this is the way you have to approach about the screening protocol, same like this breast. What is the category 1, category 2, category 3, and what are the recommendation for the investigation like mammogram when you will start in the general population, when you have to start in case of like moderate risk patient, and in case of high risk patient, same like prostate, same like lung and other cancers as well. So for that, this book is the recommended, and this is very important book. RACGP Red Book, 10th edition. RACGP Red Book. And this is the 10th edition. Before that, it was 9th edition, but nowadays, this is the 10th edition is recommended, so you have to go through with that. Okay. Okay, Dr. QBank. Yeah. So QBank is important. At the end of the day, you have to go through with QBank at once you have done with the theory, then QBank. So nowadays, e-medicine is recommended. Okay. But before there was Amedix, but nowadays e-medicine. So e-medicine is a very lengthy bank, like almost it is 4,800 questions. Okay. And 4,800, it is difficult to cover a whole question, but you have to approach, like as we discussed before, topic topic wise. Okay. Yeah, if you want, you can do both, but no need to worry. I will not recommend. But selective topic, as I told you about in case of ENT, you can do that. This is a good bank, but because you have no e-medicine and it is a lengthy bank, so that's why I will emphasize you can invest your time on e-medicine as well. Best Q bank is the recommended nowadays. This is the best. So best one. Okay, doctors. So e-medicine is the recommended. So forget about the emetics. Emetics just do a selective the things we discuss. Yeah. E-medicine is a like a cheap Q bank. Almost 6 month subscription is I think 24K PK. Doctor, we compiled this QBank as well, and before that it was Amedix, and Amedix is one of the costly bank. When we get Amedix, it is almost 180 USD cost for per month. So we decide to compile it, and know our QBank is circulating in each and every group, either it is Telegram or WhatsApp group. So we compiled the Amedix 2025 latest one, and this is one of the expensive bank, 180 USD dollar just for 1 month. And then we compiled it in the form of PDF, and now we provide to all our candidates, either it is enrolled or not. But eMedicine, we are also compiled this eMedicine, but it is a cheap bank. It is better to get online, so you can search the topic as well. In the form of PDF, it is not possible to search, but online you can search. Okay, next we have recalls and study partner. In AMC exam, the recalls and study partner is one of the like key factor, key to success at the end of the day. If you have a very good or healthy study partner, believe me, you are very lucky in case of AMC journey, especially because this one you will get a lot of question like which is a very confusing and have multiple guidelines. So which guideline is recommended for that? So this will be the confusing part. But once you have a study partner, it means like, for example, not two big group, but two, 3 or 4 people are solving one question together. So it means 4 brain are working. So every brain have different suggestion. So it is easy to go with result and decide the things as we do before. So, and they will also help you to be dedicated on daily basis. You have a proper time to study for that, and a lot of other benefits from the study partner will be dedicated, will give you a motivation in the depressed stage. And so that's why the good study partner is important for you, and this will make very easy life in your AMC journey as well. Okay, what about the recall? So everybody about know about the recalls. Recalls means there is like a previous month's exam question. This what we called as a recalls. So recalls you must do at least 1 year of recalls. Must at least. Okay, must do. And if you can go with the 2 years of recalls as well. But if 1 year you must do. Okay, with your friend. From where we can get recalls. Okay, doctor. So I will tell you. Yeah. Okay, so this is the thing that you have to approach accordingly. So QBank recall, study partner, resource, this is the thing. And what else? Okay, doctor. So have you any question about resource? Then we move to the next part. Okay, I can see your chat box. So let me answer your question. If I start from this month from scratch, then in which month it will be good for me to take the exam this year? Please guide. Okay, doctor. So I didn't see your name, but the thing is that it depends upon you how much time you give per day. But the time recommended, like 6 to 8 months, is enough for exam. Okay, if you give a dedicated time. If you give a dedicated time, 6 to 8 months is enough for your preparation. And for example, you have start your preparation and firstly do the theory within 2 to 3 months. Then you can get idea about the exam, how and when you can give your exam as well. So overall, 6 to 8 months is enough for your exam. Next question. Can we do both? No, doctor. E-Medici just enough for your exam. Best Q bank is E-Medici. Yes. The cost of E-Medici we discuss. How much E-Medici cost discuss. Can we buy a mock exam from E-Medici? We have to buy whole. No, doctor. So you have to buy whole. So this is just 24K PTR. This is a not expensive bank, and we also share with you this Q bank. We already shared with our in our channel groups as well. So you can get over there as well. Both E-Medici and Remedics. Okay, this is not we came from where we get recalls. So recalls we can. I think you haven't attend our recalls class as well. We have every week 1 to 2 classes. So we collect it from the candidates, those who have done their exam in every day. So we take this recalls from candidates and we add the reference in the recall. So here we have a process to solve the recalls. Like for example, you get a one question from pericarditis. Okay, so you have to go through the complete topic. Might be your friend gets the what is the investigation of pericarditis, and maybe you will get about the what is the management of question, and another your friend maybe the get question from the risk factor of pericarditis, and other one maybe get question from the clinical feature and rest of the thing. So that's why you have to go through the complete topic. If you done our recall class, then you can understand the things what I am trying to saying you. So that's why we have to go with the complete topic based study here. You go through. Yeah. So next, how much it is gonna cost to buy these resources? So doctors, the cost before that the AMC exam is expensive exam and their resources also expensive. But when we launched our platform, our aim is just to because we know the AMC exam is extremely difficult, extremely expensive exam, not difficult. If you have a right guidance, proper resource, structured syllabus, this is not a big deal. Okay. So these resource we made is easy. For example, we circulate our Q bank in the form of free of cost to all our the candidates. Either it is our enrolled candidates or not, doesn't matter. We circulate thoughts in our groups as well, so you can get over there. But before that, it was difficult, and no therapeutic guideline is a 400 cost or dollar cost. But our team is working to compile the guideline, and we are going to give the guideline to our enrolled candidates as well. So nowadays, the resource is very easy, like in front of you. As Dr. Mitchell told you that when we was in on the journey, there was a lot of difficulty. Nobody are here to guide us, and nobody tell us what are the exact resource and what are the cheap resource you can get. No, nobody over there, and we take this exam from a lot of expense. So, but no, it is very easy to go through each and everything, all the things in front of you. Okay, so Dr. Farwa, sir, will be good to do AMC-1 and after that be FCPS-1. Doctor, the thing is that if you have done with residence in FCPS-1, it means there is a good clinical experience, and this will make your CV healthy. So it is a best chance to get a job. So it means AMC exam need experience. If you have like 5 year experience, 10 year experience, 2 year experience, your CV will get priority as compared to others. So do you upload all the recalls explanation? Do you weekly on your website? Yes, doctor, we have a recall discussion as well. So this is the thing, just we will let you know. So this is the our AMC-1 success stories. So a lot of candidates are preparing and some of them are fast as well. So this is the February 2026 result. So Alhamdulillah, so far the MC Prep Academy result is 100%. The way we delivered in a very comprehensive way so far is 100%. This Dr. Aima passed and other doctors as well. Dr. Emily joined us and she passed as well. So this is the February candidates, and this one is November 2025 candidates result as well. So Dr. MP Singh passed as well. And this is the our feedback by our candidates which is enrolled and which they passed from us. So you can see the way we teach exact to the point. Actually, the thing is in AMC exam, so you have to go with the topic wise in organized structure way. So we are delivering the things in very well like organized way. All the things you will find on the website. So this is the important things, topic based study according to the guideline, according to the reference and to the points. No need to, as I told you before, no need to go for the complete system. No. For example, cardiology. So the beginner students don't know about, they start the cardiology from phase 1 to till last phase, but it is not worth it, and it is a time taking. So wastage of time. So you just have to go with the topic wise, the important topic. So our only topics discussion, our the things we deliver to AMC aspirant only, the things which you need for AMC examination, nothing else. So we are only specialist in AMC exam. So that's why we know the things which is important for AMC. We only deliver that things. Okay, a lot of other candidates feedback as well, you can see. So a lot of candidates is preparing, and every month they are giving exam. So Alhamdulillah, the things we committed and we are delivering as well. So a lot of other candidates feedback as well. Okay, so next question, as your doctor told me about the shared the list of topics. Doctor, this is a lengthy list, actually a lot of things to discuss. So that's why it is difficult for candidates to go through the system. But I already told you the website of the each and every subject, how you can start your preparation and what are the resources to follow. So that's why here the candidates feel a difficulty. For example, in like other exam, for example, in other exam, like if you talk about the USMLE exam or PLAB exam, they have structured syllabus. Like you can go with the first aid as well, then you can go with the U-word, and then you can attempt their Q bank as well and go for exam. But in AMC, it will this thing will not work. No, as I told you, the things 30 to 40% from the John Murtagh. So this is the actually blend of the different things. So 30 to 40% from John Murtagh, then you have to go for the Q bank. Okay, then you have to go with the handbook as I discussed. Then you can go at the end of the day. The calls will help you to it will decide either you will pass or fail your exam. So 30 to 40% from John Murtagh. After that, this resource QBank along with handbook along with the recalls, this will give you the 60 to 70%, and also the screening book, cancer screening book. So, and this will make your like 100%, and you will go to the exam. So this is the way that you have to approach. Not only the John Murtagh will be the enough for your exam, and a lot of doctors are asking about the John Murtagh. It is enough to go through the whole John Murtagh. No, no, a lot. Many topics are not there in the John Murtagh. So that's why you have to approach the things in way. And in our lecture, we only focused on the things which you actually need to pass your exam. So very well structured way, because our mentors are MC qualified, so we deliver the thing. And just a short review about our course, those who are new here in today's. So we are offering the AMC regular course. Regular course means, what is the meaning of regular course? Regular course means you will get complete AMC-1 course. Yes. So complete AMC-1 course. Look, okay. What is the complete AMC-1 course? You will find out the theory lecture, recalls. Okay. You will get out the you will get mock test as well, mini mock test, recalls mock test. So all these things you will find out. So what inside? So daily we have a session on the AMC theory session as well, recalls classes, and as well as the AMC-1 notes. In our lecture, the another thing we made a notes for each and every system. For example, cardiology. What are the things is important? We made a note. And each and every system we made a note. So the important thing from each and every system we compiled in the form of notes, and also we integrate the therapeutic guideline along with that ETG guideline. So the therapeutic guideline where this guideline is required, we integrate. So you will get the expert mentor support till your success. Recall group discussion. We have a lot of group as well, and our enrolled group have a separate discussion as well. You will get a 24/7 LMS access for 10 months. So 10 months is basically more than enough time for preparation. Okay. And you will get the structure exam focused preparation, because we are only specialist AMC exam. So our aim is just to deliver the content on the AMC examination as well. And a premium add-on. What is the premium add-on in our subscription? 100% free of cost. You will get 2025 and 6 core concept recalls, which is integrated with Australian guideline, and also free access to the premium Q banks, both e-medicine and analytics. This is a free of cost we are providing to our candidates, and I can tell you nobody will facilitate these things to candidates. But our aim is just to pass our candidates in first attempt in a minimum cost. And another things, we have launched our another course. This is a recall course. Those students who have done with the theory and know they have exam in next 2 to 3 months, and they just need recalls, they can get the recalls as well. So recalls we are designed, as I told you before in the start, we designed these recalls as much like Australian guideline. Like you will find out the pilot question as well, low scoring question, high scoring question. Okay. and also under the exact time frame, 84 seconds for each and every question. So basically, we design our new website LMS according to the Australian software-based exam, which is exactly you will find out see in the real exam. So that's why your nerve will be sensitized and you will feel the pressure and how the things will work. And we already finished the records of 2025 Feb to November, and now 2026 is ongoing, and we are uploading when every month exam. So after that, we upload mock test, low pilot scoring, high scoring question, so high yield focused content. And after the test, for example, you have done with the test, and after test, you have view option over there. So view to the explanation for each and every question we add. For example, either it is a good your correct answer or not, doesn't matter. After that, you can go through, and over there in explanation section, we add complete topic based explanations along with the guideline reference guideline reference. Okay. So you can go through with the core concept as well. We mentioned the things in the highlighted form as well. We add the thing in the text form explanation, add the thing in picture form, and also mention the guideline link. So guideline is a major challenging part for AMC candidates now. So we mention also the guideline links over there, so you can go through with the specific guideline. So this is the thing we are delivering, and the Alhamdulillah, our result so far is 100%. So I am very humbly say credit goes to Allah Almighty. But and inshallah, we are very dedicated to deliver the quality based quality based education to all our AMC aspirant as well. And we are also taking this free of cost at the records classes as well. If you are in our channel groups, you can get links over there. But if you want to enroll for the complete course, for those who want to start preparation from the beginning, so they have to definitely join the course. You will get the each and everything in the form of structure. As you are asking about the what are the topics, so there is a lot of topics. It is impossible that the right topic in a single webinar. So every system have their own topic, so we have to go through accordingly, and our content only on that as well. Dr. Noor, Dr. Okay, doctor. So every question, every system, for example, as Dr. Saab is asking about, after taking your lecture, it is necessary to read John Murtag or other recommended books that tell or other covering lecture. We not need to. No, doctor. So each and everything we compiled in the our lectures, we integrate all the guideline in the our lecture. So you just watch the lecture, and we explained all the resource in the lecture. So the all resources we open throughout the lecture, and the information we discuss is enough for your exam. No need to go for the extra John Murtag. I also mentioned at the start of each and every system, I mentioned the things. This is the only chapter which you have to go through, and we already go through that chapter. Only selective things we have done. So no need to go through the extra thing from the John Murtag or any other stuff. Each and every subject we have covered from the guideline. So if you know the guideline, if you know the things, good to Doctor cost. Doctor, actually, if we talk about the AMC exam is expensive, one of the expensive exam, and their resources expensive. But we are the first in Alhamdulillah in Pakistan that we are dedicated to deliver the quality based education in very minimum cost. And this is not our just this is a not our cost monthly. We have a lot of expense website and other lot of stuff. But the course price is 299 USD. Okay, but the discount so far is going on. So till 25, you can get a 25% discount, and after discount till at April, 15 April, and you can get it into the like 225. Yeah. So this is the discount is going on till 15 April, and you will get a complete course. For example, when you enroll in our theory regular course, this recall course is a free of cost added in your subscription. Okay, along with the both Q bank as well. And if you want to enroll in the only recall Q bank, as you done with the theory, you can. but this is only you will have access to the QBank. But if you enroll in the theory course, you will get each and every content which is available in our website. Okay, doctor. So anything else? Okay. So doctors, another things, two golden rules of success as we gone through the same system, and the things which I experienced throughout the journey, we have two things, lamma sabr, and the second thing is yaqeen, or yakin yokin. So this is the thing that uh, you have to put your uh, tawakkul on Allah Almighty, and inshallah, at the end of the day, you will be successful, inshallah. So this is the golden rule, and this is from Quran. Another things which we have left, yeah. So if we pay to 55 US, do we get our, yes, doctor, you will get our resource, our content which we delivered so far, you will get. Yeah. Yes, total cost of registration, Dr. Mehta. Okay, we are here. But total cost, okay, doctor. So total cost is the first of all you have to create account on Mind Health, and this will be 100 USD. After that, Epic portfolio and $30 cost, or Epic credential, it is 100 USD again. And once you have done with the Mind Health account, then you can go with the AMC portfolio. Okay, and AMC portfolio is 648 Australian dollar. Okay. After that, once you have done with your portfolio, know your portfolio is functional, you can book your exam, and this exam cost is 2950 Australian dollar. So almost nowadays the Australian dollar is the expensive a bit. I think 197 PKW. So almost 590,000. So 590,000 nowadays is a cost as well. Yes, doctor, we will provide you the John Murtagh, we will provide you complete books as well, John Murtagh in the form of PDF as well, UBank as well as books. So this is the thing will be accessible. This is not a big game. So the big game is that you will get out the recalls and get out the structure syllabus. Rest of the things you can find, and we will also have these things on the website as well in organized way. All books, theory books course will be available on website as well. So doctor, this is the cost. You can calculate these things and good to go. This is the AMC-1 cost. Yes, sir. Okay, doctor. So do you have any question? I think no, you can decide your journey. Either you want to pursue or not, because we have done with the AMC-1 resource as well. And what are the things will be happen after AMC-1? We have discussed these as well. But if you have any specific concern, please let me know. Dr. Noor have very specific concern. Your course also provide therapeutic guideline. Doctors, actually, our team is working on that. We will also provide this guideline to our candidates as a gift, and a lot of other gifts we already give to our candidates, but yet we didn't provide this guideline to candidates. But inshallah, in next week, the team is working on that, and we hope so we will provide on that. Another a lot of things, doctor, we provide free of cost QBank as well. The recall QBank recalls, as I show you, this is our separate course, but for our theory course students, this is a free of cost, and this is another cost as well, along with the both QBank. So a lot of things we are providing, but you just have to put your efforts, and actually your payback is your success to us. No, we are just struggling on you, our candidates. Yes, doctor. No, is April. Yeah. So you have 7 months. Doctor, one another thing. So, for example, you have booked your exam for August. or July, and know you are near to exam 1 month apart, okay, and know you want to reschedule, so you can reschedule your exam free of cost, okay. So free of cost you can reschedule your exam. Even you can reschedule your exam 10, 20, or 30 times, doesn't matter. And this is a free of cost. But you have to reschedule before 20 day of exam. Before 20 day. For example, you have booked your exam right now for October or September, and when once you are near to exam and you are not well prepared, you want to reschedule, you can. Yeah. Yes, doctor. MOship count as a clinical experience. Why not? Yeah. How much time we need to give during house up to give AMC at the end of house up? Doctors, it depend upon the house up, your rotation, because some patient are so hectic. But if you, for example, if you give like 8 to 10 hours per day, this is a good time. So you can prepare yourself within 6 to 8 months as well. Or if you can at least minimum 8, 7, 8. So you can prepare in 6 to 8 months as dedicated way. Not one day you can study 12 hours, next 2, 3 rest. No, you have to give the dedication to AMC again. And while house up, it is the best time, even in the final year, you can prepare your exam. For example, for final year students, because final year subject is a totally medicine oriented clinical subject, and AMC is also totally clinical subject. So for final year students, they can start these resources which I tell. So till at the end, they are enough in the clinical knowledge, and after that, they can go with the Q bank as well, and because and good to go before your house up, you can give exam. And those who are in the house up, side by side, they can start preparation. So after immediately house up finish, you can prepare for your exam. But you have to make sure the things that you will get enough time for study as well. Doctor, do you house up is a not necessary for AMC exam, doctor? Not necessary. You can give without house up. Not it is not a mandatory part. So, do you provide the recorded lecture or live classes as some students are in their house up? So, no, yes, doctor. We have our website. Okay. So, in website, you have to make account. So, you have 24/7 access for 10 months. So, the live session which you missed, you can go through it your own time on website as a recording. So, our website is amcprepacademy.com. Next, what's the best time give AMC for recent graduates, sir? Doctor, actually, you just need you must have your MBBS degree, and it will be verified from the Mintel, and then you can give your exam at any time. Once you have confidence in your preparation, you can go with that. Sir, I have heard house up is a necessary. Can you confirm? No, doctor, it is a not necessary part. Not necessary. Okay. But it is good. Like if you have done with Hausa, it means you have experience. So it is a good thing, but it is a not a necessary like OET. OET or PT exam. This exam you will not required for exam. Okay, not required for exam, but for you need this for job. So once you have done with the MC1 and know you want to apply for job, even after MC2, you must need OET or PT. And PT is the one of the cheap exam and easy exam, so you can give as well. Sir, your live classes will be probably on which time? Doctors, the theory part we have done. Nowadays, recall classes is going on as every month recalls when we received. So this is at night time. Yeah, 9 Pakistani time. Yeah. What if we don't have clinical experience? Can we apply for AMC-1? Can we get job? Yeah, doctor, clinical experience, it is a good thing, you must know. But if you don't have clinical experience, you can go for observership as well, also work on the CPD. So this will make a good chance for your job application. Yes, doctor, you can give your PT. Doctor, PT you have to done when you want to apply for job. And job you will apply after AMC. Simple. For exam booking, there is a and not any mandatory things to do quickly. Okay. Sir, we don't get degree immediately after final year, so degree is necessary to apply, or we can apply on certificate basis. No, doctor, degree is a necessary, but you can start your preparation in the final year as well as a lot of our doctors even in the final year and in house sub and resident they are preparing. So you can start your preparation once you get your degree. This is the degree verification is a process of 1 month till portfolio. So when you get your degree, you can straightforward go for exam. But firstly, you have to prepare yourself, and this will take time. No, doctor, degree will be mandatory. So degree must, because you have to apply for mind health, and in mind health degree will be. So you have to make account on mind health, and this will need MBBS degree. So we do see is CPA and observership if we are not a student. Doctor, this will like for observership, you have to go for Australia, but the CDP you can go to in your own country. You just have to download the application, like as I written here. So yeah, so CPT you can search right now. Tracks up a website also OSMED CPD. This is also application available, but if you search the website, they will give you direct reference link. Med cost or TP. This will be will you have to make account on that, and this is some of them is a free article and some of them is a paid article, but you can go for the free one and they will give you a CPT hours as well. If we buy your course, then during HOSA we have not enough time to get lecture on time and complete our lecture hours. Can you offer longer duration for us? And yes, doctor, if you are like 1 month apart, so we will give you extension as well. Don't worry, sir, we don't get degree immediately. But doctor, CPT is a not, it depend upon your capacity, how much time you listen per day. It is not a big task, doctor. Even one day, how much time you have listened the like their article, so they will give you accordingly. Every student can get. Why not final year if you have done with AMC exam? So why not? Every student can get. This is like continuous personal development program. So this is not like for those who are only the senior one. Everyone can get those who applied for AMC examination. Doctor, any your other concern regarding today's webinar? So, doctors, does it make sense? The things we discuss, doctors, does the thing make sense? No, you you must have your clear cut mind what you will do. Either you will pursue for AMC, and for AMC you must know the resource of the AMC, right? And so your reaction will be changed from this guys to another person. Okay, so source for surgery other than trauma chapter. Doctor, trauma is the important part. So other general surgery, the general surgery question covered in like from John Murtagh as well. So general surgery you can done in the John Murtagh as we have done in our lecture as well. So for trauma you can go with the trauma part from Kaplan. For ortho bullets you can go with the John Murtagh. Yeah. Okay. What other? So can you please tell me more about the GMC registered and AMC pathway? Doctor, GMC registered pathway, it means you are talking about the competitive authority pathway, right? So competitive authority pathway, for example, in UK you have done with PLAB and you have 1 year of experience working in UK. So you can go Australia without AMC examination. So you must have 1 year of experience. Same in USA, you have experience of working in USA, and after that you can go with that. This is for those who have done with the GMC registration and do the practice over there, like after PLAB or MRCP and other stuff. So, okay, so what other? What about the getting visa after exam? Yes, doctor, it's depend upon the requirement, visa requirement, like you have to show the bank statement as well along with the documentation. So depend upon the condition. But if you have received the like job application letter from the hospital, so it is totally easy and the hospital will sponsor you. Sir, please share this video session on YouTube. Yeah, so can from where we can buy a book? Yes, doctor, you can. Jana book, yes, you can. You can order as well. So the only one book you just need to buy, like John Murtagh. You can buy this book, and the things like important you can write over here and make a notes as well. So the rest of the things will be you will find out in online form. Yes, doctor, you can get access to the previous one as well. Yes, you will get complete plan. Don't worry about that. So, doctor, does the AMC exam make sense to all of you? What was your before feeling and right now? Do you heard about this information before that, or first time you are listening this thing? Might be you are struggling to find the stuff from the other side, but have you find it? Thank you, Dr. Ashraf. Thank you, Jazakallah. And so, no, the AMC exam is accessible and easy exam if you have a guidance. So AMC need just proper guidance. As you can see, every subject have their own guideline. So you have to approach accordingly, not to approach randomly. The you can go with the like other books, medicine oriented books. No, you have to approach smartly. And AMC just need your smart approach, not to go for the hard or struggleful journey. Dr. JMS first time good section. Thank you, Zakallah. Dr. Nimra, thank you. Okay, Doctor. So here we end our today's session. So today is also weekend, right? Thank you, Dr. Aisha. Thank you, Zakallah. Please remember us in your prayers. So Inshallah, we are here to support you till your success. Our main agenda is your success. So, but you have to give your time, dedication, and rest of the things we will provide you, and you have to put your trust into the Allah Almighty, and the good things will be with you. Doctor, believe me, I am even my candidates asking question at 2 a.m. and I replied at the time. Okay. So this is not a matter. We are here to support you till your exam, and no, our candidates have exam from Monday. So I am very busy with them, and every time available for them. But we have to arrange this session because a lot of doctors are asking me about the guidance guideline. So this will be a very time-taking process. So that's why we arrange in a collective way and other stuff. I am very busy with my candidates as well, but I have to respond each and every person, either it is enrolled or not, doesn't matter. Okay, doctor, then thank you for today's your presence. The main issue for beginner are where should to start. I think today lectures made a full sense for all of us. So Jazakallah sir. Thank you. Thank you, doctors. Thank you, Zakala. You have to start from the theory first, like we discussed from the medicine subject theory first, and then once you have done with the theory, then go for Q bank as well. After Q bank, or even you have done with the 50% Q bank, it means the things make sense to you at that time. You can start the recalls and as well as the handbook. So good to go. So this is a stepwise approach. No need to go for the I am seeing the group. Someone is sharing the I think any notes picture AMC1 notes and saying that do this and go for exam. No, 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 this is a never recommended. Don't take risk. This is an expensive exam. So you have to follow the protocol of AMC examination. Then you have to go because this is expensive exam and difficult to bear. So at least firstly you must know the source and the things. Then you have to go for exam. And so you have to approach stepwise as we discussed. If you follow this structure, inshallah, I will give you a guarantee. Inshallah, you will pass. You have to fulfill the protocol and the guidelines. Okay, doctors, thank you, Zakallah. I hope so. All your question is sorted. So we will also upload this to in our YouTube channel.